Albert Ross Tilley. His exceptional skills and radical new medical techniques, his total devotion to the treatment of airmen's burns and reconstruction of deformities, his understanding of the need to treat both the body and the spirit, giving his patients the will and ability to reintegrate into society, have benefited Canada and the world. Albert Ross Tilley was born in Bowmanville, Ontario, November 24, 1904. The son of a country doctor, he attended the University of Toronto and graduated in medicine in 1929. He trained in plastic surgery in Vienna, Edinburgh, and New York. In 1935, he joined the RCAF Reserve, and in 1939 was called into active service as a captain in the Royal Canadian Army Medical Corps. He transferred to the RCAF medical branch and was sent overseas in 1941. With his experience in plastic surgery, he was posted to Queen Victoria Hospital at East Grinstead, Sussex, in January 1942. From the early days of the Second World War, seriously burned airmen were being treated here by the brilliant plastic surgeon Dr. Archibald McIndoe. Most of the burns involved the face and hands, suffered when the fuel tanks of aircraft exploded on being hit by enemy fire. McIndoe gathered the growing numbers of burn casualties into a former Army hut behind the hospital, known as Ward 3. As the air war intensified, the number of Canadians being treated at the Queen Victoria Hospital increased. A Canadian plastic surgery unit was established under the command of Dr. Ross Tilley. He persuaded the Canadian government to build a new 50-bed wing at the hospital. Wing Commander Tilley was named commanding officer with a staff of over 50 Canadians. The treatment of burn victims had not progressed much from the methods used in the First World War. The standard treatment was to apply gentium violet or tannic acid to dry the wound and prevent infection, often resulting in severe deformities and devastating loss of function. But that was about to change. Tilley and McIndoe discontinued the earlier barbaric practices. They pioneered innovative techniques such as the use of saline baths to ease the pain and facilitate cleansing of the burned areas. Tilley encouraged the dead burned tissue to slough off, aided by soaking in saline, followed by the careful removal of the burned slough, a long and painful process. After many such debriding sessions, a thin sheet of skin was taken from a donor site, usually on the thighs, and the graft applied to the raw areas. With the typical airman's burn involving deep damage to the face and hands, this thin skin cover was only the first stage in the healing process, and areas such as noses, ears, eyelids, and lips needed much more than just a thin skin covering. Eyelids were reconstructed with skin grafts from the arms. Segments of scalp became eyebrows, and ears were rebuilt. In some cases, entire faces were rebuilt involving transfers of tissues from other parts of the body. Dr. Tilley was more than a skilled surgeon. He knew that the reconstruction of the spirit was as important as rebuilding the bodies of his patients. Tilley, who was a man of keen intuition, excelled in dealing with the extreme psychological impact these young men suffered. He and McIndoe repaired the airmen to the point where they were not only recovered from the physical shock to their bodies, but recovered from the horrific shock to their spirits as well. Airmen's morale was of prime importance in the rehabilitation process, and the two surgeons found ways to cut through any red tape seen as obstacles to their patients' recovery. Patients' rank was disregarded, and all were allowed to wear their service uniform. Thus, they remained fighting men in their own eyes and in the eyes of others. Since many of the innovative treatments were still in the experimental stage, these badly disfigured, courageous young men considered themselves, with some pride and considerable justification, to be guinea pigs, a name they proudly adopted. In 1941, they formalized themselves into a guinea pig club, and, in self-mocking humor, they elected a secretary who could not use his hands to take notes and a treasurer who was in a wheelchair and not able to run off with the funds. Life had to be worth living again. Dr. Tilley was a fervent advocate for the airmen in his care. His approach to his guinea pig patients was firm yet gentle, and he was in many ways a father figure, confidant, and advisor to them, always there to help in any aspect of their lives. They affectionately referred to him as Winko. Patients were taken out to the local community as soon as they could stand or navigate in some way, many in various stages of facial reconstruction.
Not many hospitals or many surgeons give us their first instructions after an operation to get up out of bed and down to the pub. And this type of atmosphere was what prevailed. And Dr. Tilley certainly fitted into that.
The people of this small town of East Grinstead quickly accepted them, and by treating them as local lads, helped them adapt to the normal activities of life. They became familiar sights around the town, and many were invited home, to the cinema, or to a dance, and some met and married local girls. This attitude fostered earlier healing of mind as well as body, and these patients never lost hope. Those who were physically capable returned to active service much more quickly, and some went on to distinguished flying careers. Moreover, the reputation of Dr. Tilley and his staff became known throughout the service, generating a great feeling of relief among active aircrew who knew that in the event of a burn injury, they would have the best possible treatment. At the end of the war, Dr. Tilley, by then group captain, was discharged from the RCAF and returned to Canada, with knowledge and experience unequaled by more than a handful of plastic surgeons anywhere in the world. He practiced at the Wellesley and Sunnybrook hospitals in Toronto and taught courses in plastic surgery at Queen's University in Kingston, Ontario.
Well, my lords, gentlemen, fellow guinea pigs, we welcome you all, particularly our friends in Canada.
Of the Guinea Pig Club's 649 members, 176 were Canadians. The club continues to flourish as a classic example of what is now called group therapy. It has been a source of mutual strength and great pride, sustaining many Air Force veterans through difficult times as they returned to civilian life.
Really, you rest assured that as long as there's a guinea pig alive, there'll be a guinea pig reunion.
Ross Tilley married Jean Russell in 1952, with whom he celebrated 36 years of marriage. He retired in 1980, but continued to hold burn clinics until 1983. In 1944, Tilley was appointed officer of the Order of the British Empire, and in 1981 was appointed member of the Order of Canada. He was a fellow of both the Royal College of Surgeons of Canada and the American College of Surgeons. He was one of the 12 founding members of the Canadian Society of Plastic Surgeons and was the Society's 8th president. His life and achievements are commemorated by a number of lasting tributes, including the establishment of the Ross Tilley Burn Center in 1984, first at the Wellesley Hospital and then at Sunnybrook Health Sciences Center in Toronto. The Ross Tilley Foundation provides for a scholarship to be awarded to exceptional plastic surgery graduates, the winner of which shall present the Ross Tilley Memorial Lecture to the Canadian Society of Plastic Surgeons. The Ross Tilley Public School was opened in 1996 in his hometown of Bowmanville. Dr. Tilley died in Toronto April 19, 1988, and is remembered with reverence and great affection by his remaining guinea pigs and colleagues. A. Ross Tilley was inducted into Canada's Aviation Hall of Fame at ceremonies held in Montreal, May 27, 2006.